Hello, my name is Benson and I'd like to tell you about our article in the January 2019 issue of the AJO DO called Resin-modified glass ionomer cement versus composite for orthodontic bonding. As clinicians, we know that enamel demineralization is a potential adverse effect of orthodontic treatment, particularly when using fixed appliances, and we continue to look for ways of preventing it. We carried out a randomized clinical trial with two parallel groups of participants, one receiving light cure composite for bonding upper and lower arches from premolar to premolar, the other received resin-modified glass ionomer cement. We had a combination of participants from both specialist or private practice as well as two teaching hospitals. This is important because we need to do more research in practice where most orthodontic treatment is carried out. Here is a chart showing the flow of participants through the study. We had 13 withdrawals and dropouts. The average age was 17.5 years and there were more females than males, which we find is normal for orthodontic treatment. What did we find? Well, there was no statistically significant difference between the two groups in the proportion of patients with at least one first-time bracket failure from premolar to premolar. There was, however, quite a big difference between the clinicians involved. We asked up to 5 judges to look at photographs taken before the appliances were fitted and on the day of debond to decide if there were any new demineralized lesions and which teeth were affected. Out of the 173 participants with adequate pre- and day of debond clinical photographs, a consensus was achieved that 42 had at least one new demineralized lesion, which is an incidence of 24%. The most commonly affected teeth were upper lateral incisors, followed by upper central incisors, and then upper canines. There was no difference in the proportions with new demineralized lesions bonded with the two materials. We then asked a combination of 3 clinical experts and 3 lay people to look at the 42 images with demineralization to judge if they thought these were of aesthetic concern. In 15 out of the 42 participants, there was a consensus that the new demineralized lesions were of aesthetic concern. The overall incidence of participants with new demineralized lesions that were considered of aesthetic concern was therefore 9%. Again, there's no difference between the two materials. We think our study has a number of strengths over previous work in this area. However, one weakness of the study was that as it was set in busy practice settings, some clinical images were missing and we were not able to assess all the participants for new demineralized lesions. We conclude that using resin-modified glass ionomer to bond brackets did not reduce the incidence of demineralization during fixed orthodontic treatment. Neither was it weaker than light cure composite and fail more frequently. The operator seems to have a greater influence on this than the material. There might still be reasons for using resin-modified glass ionomer. These include reduced sensitivity to moisture control during bond-up, easier and quicker removal of material at debond, and potentially lower environmental and cytotoxic impacts, which is an area which should be investigated further. This study was supported by a grant from Sheffield Hospital's Charitable Trust and a generous donation of Fuji Ortho LC bonding adhesive from GC Corporation. Thank you very much for listening.